into clinical and demographic perspectives of occupational eye injuries by Dr. Shubhratha.
Demographic profile, perspectives of occupational eye injuries. Occupational eye injuries are defined as the injuries occurring as a direct result of work or conditions at the workplace. It is the leading cause of ocular trauma worldwide and constitutes to about 22% of the total ocular trauma in India. The toll of these injuries go beyond pain and visual limitation. The reassuring fact is that most of these eye injuries are preventable. Occupations and type of activity at risk for injury vary from region to region and needs to be identified in order to plan preventive strategies. So this study was done to analyze the demographic and clinical characteristics of occupational eye injuries. It was a prospective study of 1 year duration, and all patients with occupational eye injuries presenting during the study period were included. Those with coexisting ocular pathology were excluded. So detailed history was taken, comprehensive ophthalmic examination was done, and standard care of treatment was provided to all patients. And the statistical analysis was done using the following tools. A total of 316 patients were included in the study, and majority of them were men. This was similar to the results of most other studies and can be explained by the fact that traditionally the men are more frequently employed in high-risk occupations as compared to women. And majority of them were young, with about 58.9% of the patients in the age group of 21 to 30 years, thereby suggesting that inadequate work experience may have a role to play. However, other studies from India suggest that occupational eye trauma is more common in older age group, contradicting our results. So injury was more common in unorganized sector, with arc welding being the most common occupation at risk. Previous history of eye injury at workplace was noted in 65.8% of the patients. This result was higher than the results of the other studies, which ranged from 4 to 34%. And all these patients were engaged in welding or grinding work. This goes to say that recurrent eye injuries are more common in unorganized sector, like small fabrication enterprises, where safety training is not provided to the patients. And eye injuries are not acknowledged enough by the workers or the employers to promote adoption of safety measures. Unilateral eye injuries were more common than bilateral, and most of the patients presented to the hospital on the same day as the injury. And corneal foreign body was the most common type of eye injury seen, and closed globe injury was more common than open globe injury. However, open globe injury was associated with poor visual prognosis, and it was common among carpenters. Most of these eye injuries can be prevented by use of appropriate protective eye gear. In our study, about 95.25% of the patients did not use any safety devices at the time of injury. Interestingly, about 61.79% of these patients had access to these safety devices. The reason for not using them was inability to see clearly through it. Some forgot to use, and some without any reason. Studies have found that though workers had knowledge and access to the safety devices, they did not use it due to ill fit, poor visibility, and the discomfort caused. A small percentage of patients had injury despite wearing these safety devices. This questions the efficacy of these safety devices. Hence, there is a need for provision of effective, user-friendly protective devices with a good fit and good visibility. Most of them had good final visual acuity. Permanent visual impairment was noted in about 20.8% of the patients. The limitation of our study is that we did not study the employment pattern of the patients as permanent and temporary, and since it was a hospital-based study, the results may not reflect the actual epidemiology. Yet, this study can serve as a baseline data for further studies to generate input for policymakers. To conclude, this study provides insights into the clinical and demographic characteristics of occupational eye injuries. These injuries can be prevented by use of appropriate eye gear and safety training. While planning preventive strategies, Priority should be given to workers involved in metal work, agriculture and carpentry, where increased frequency and poor visual prognosis is seen, and specific interventional programs should be planned to prevent recurrent eye injuries. Thank you.
Thank you, Shubhratha. What was the inclusion criteria for these patients study?
All the patients with the injury at the workplace were included in the study during the study period.
Because that will be a vast thing, and it will be haphazard. You cannot classify all types of injury in this type of thing.
Yes,
So
but
it should be specific, whether it is a farm injury, or it is a chemical injury, or this is due to some.
ma'am, we have we included all the workers and then we classified whether it was agriculture related or metal work related or
No, what I want to say, you cannot compare the different type injury with each other.
yes.
So
Yeah, there is a
study
wide
should be-
variation. Yes, I agree.
Study
That.
should be having a strict
Okay.
pattern.
Yes.
Thank you.
जैसे इतना कॉमन है बट एग्रीकल्चर इंजरी बहुत कॉमन है
हाँ.
इस देश में
Yes.
एग्रीकल्चरल फार्मर्स की इंजरी बहुत कॉमन
Yeah, हमारे स्टडी में वो सेकेंड नंबर में था. Yes.
You said that you had a younger cohort of patients. So what was the occupation of the patients who were there in the other studies, who were of older age group?
It was the results. Other results were similar, ma'am. Cornell, in like other Indian study from north and northeast, two studies are there, and the Cornell foreign body welders were the most common. But they have also found that construction workers are also an important occupation where eye injuries are common, which we did not find in our study.